Okay, I'd like to welcome everyone in tonight to Momentum Chiropractic's monthly health talk. I am Dr. Nico Rocco, and this month we're going to be talking about lower cross syndrome. You may have been tuned in last month when we talked a little bit about upper cross syndrome, which is an occurrence in the upper part of the body. It happens in the shoulders, the chest, a combination of tight muscles and weak muscles, and it really can cause people some issues. Now, this, as the name may indicate, lower cross syndrome, this happens in the lower half of your body. This is going to be the people with the low back pain, people that sit a bunch. We're going to get into it. We're going to talk all about the lower cross syndrome. So um, let's get into it. Lower cross syndrome, it's a condition, common condition, very common. It's brought on by poor posture over a long period of time. This is characterized by some overly tight muscles and overly weak muscles in a cross pattern. And so with the graphic here, we see that exactly. The weak abdominals and the weak gluteus maximus, also the gluteus medius comes into play. And then crossing that, or making that X pattern or crossing pattern, the muscles are going to be tight. So you're going to have the tight erector spinae muscles and the tight iliopsoas muscles. So factors that increase lower cross syndrome. Lower cross syndrome is going to be more common in people that drive long distances, that travel via airplanes, buses. You're sitting for long periods of time. Maybe sitting at a desk for work or for school. Students, I'm starting to see this in students in my office a lot. Students that are sitting all day in school and then getting home and sitting and doing their homework, and then after homework they're sitting and playing video games all night. They're in that seated position for sometimes 20 hours a day. It really can give them some problems when it comes to the lower half of the spine, pain in the lower back, discomfort in the lower back, things like that. So another factor, sitting and watching TV. People that are overweight or out of shape are going to be more prone to this lower cross syndrome because the muscles in that case are going to be a little bit weaker, and the muscles may be a little tighter because of the person's weight. So, and of course, this lower cross, like we said, it's going to be made worse by bad posture, and it's bad posture over a long period of time that really makes this as bad as it is. So, symptoms of lower cross. We're going to see reduced mobility in the lumbar, hip, hamstring, or pelvic region. So it could be any or all of those regions that you're seeing reduced mobility. You may have pain in the hip flexors, groin, spine, or buttock muscles. You may have a protruding stomach from an overly arched back. That overly arched back, that's going to be those tight muscles in the lower back, and that's going to cause your stomach to kind of stick out and your butt to kind of pop out. You're also going to have tension in the lower back or butt muscles. This could also getting back here to the symptoms, it could also progress into the pain down in the legs, the sciatic type presentation. We see that with lower cross, where these muscles are so tight or the muscles are so weak, this condition is so progressed that you see it affecting things like the sciatic nerve. So what can you do about it? The first thing I would recommend, and this is always me being a chiropractor, this is my recommendation in most cases, chiropractic care on a regular basis. A regular basis to me, no less than once a month, and really that's bare minimum. Depending on how much stress you have in your life, you are going to want to go more often. I get checked once a week because I don't want anything that goes out of place in my spine to sit out of place for very long. So in worst cases, though, you're going to have to go more often. If people come to the office, I want to sometimes start to see them 3 times a week, 2 or 3 times a week at least, depending on the severity of the case. Another thing you can do about it is stretch the tight or activated muscles. And we're going to go through which muscles those are. We're also going to go through which stretches you can do to stretch those muscles. After that, you want to strengthen or activate the weak muscles. Now, the first step of this is going to be stretching the muscles. After getting adjusted, of course, the stretching needs to come before the strengthening. And your body's going to tell you when this is going to occur. If this is a severe case, you're going to want to start to stretch first, get some flexibility in the tight muscles, the activated muscles, and then you're going to strengthen or activate the weak muscles after you have some flexibility. Another thing you can do is co-manage these with both physical therapy, which is going to address the soft tissue in the body, while chiropractic is addressing the hard tissue, the bones. You also could co-manage the massage therapy, co-manage with massage therapy. That's going to help loosen up those tight muscles. Again, addressing that soft tissue in the equation. So, I want to talk about the muscles that are involved with this lower cross syndrome. The tight or activated muscles we're going to see are the lumbar erector spinal muscles. These are the muscles that are essentially responsible for keeping you standing straight up. So, keeping you standing straight up. The rectus femoris or iliopsoas. These are going to be short in a seated position, which makes sense if you think about it. If you're in a seated position for a long time, these muscles are short. When they're short for a long time, they become tight. They become tight and unable to lengthen again. So then we see the muscles that are weak or inactive are going to be the rectus abdominis or the ab muscles, and then also the glute max or the glute and the glute medius, glute maximus. Those are both going to be weak or inactive in cases with lower cross syndrome. So, like we said, the first thing you want to do is you want to get into stretching the tight muscles before you start strengthening the muscles. Stretching the muscles is very important. A lot of people think, oh, I have a long day's work. I get up and I go do hard manual labor, so that's my strength. That's my stretching and my strengthening for the day all takes place at work. If you're doing that at work, you're going to need to stretch outside of work to keep your body ready to do that work. So for these two, we want to look at the erector spinae and the iliopsoas muscles. For the erector spinae, we're going to look at lumbar extension. We want to hold that for 30 seconds. And we want to do that 3 times. Then the iliopsoas, we want to do a hip flexor stretch. So hip flexor stretch looks kind of like this. Another way you could do it is laying flat. Another way you could do it is if you are unable to get down on the floor like this. You could find a table, you could find an area where you could put one leg on it and kind of stretch it that way. You want to do that one for 30 seconds. You want to hold it for 30 seconds. You want to do it 3 times each side, especially the side that is symptomatic. This is when we're first starting into addressing this lower cross. We want to stretch both sides to keep it even, but my guess is that you have one side or the other that is worse. And so the ones that are worse, if it's on the right side, you want to stretch that right side a little bit more than you're stretching the opposite side. Now, the next step is going to be to strengthen the weak muscles. So the strengthening of the weak muscles being the rectus abdominis, the glute max, and also the glute medius. The rectus abdominis, we're gonna do what's called a forearm plank. We're gonna start with 20 seconds of a plank, and this woman is demonstrating a plank in the picture here. We can start with 20 seconds. We're gonna do that 5 times, and we're gonna rest in between planks. About 30 seconds of rest in between. Now, as 20 seconds gets easier and easier, you can continue to build up. Go to 30 seconds, go to 40 seconds, go to a minute, go to 2 minutes. The longer you can hold these, the stronger these muscles are going to be, the better your muscles are going to be at holding your spine in place or keeping this lower cross syndrome from occurring. Another muscle that we want to strengthen is going to be the gluteus maximus For that, we're going to do a hip extension, also known as butt crunches. You may know this. Something like this. We're going to do these in sets of 10. You're just going to lay on your back, feet flat on the floor, knees bent, and then lift your hips up into the air, kind of thrust up into the air. You want to do those 10 at a time and 5 each. And if that's going to be too much for you, if you get into those and they start to hurt you, then cut it back. Start with 1 or 2 sets and build up to the 5. Now, the exercise we want to add in to do the strengthening for the glute medius is going to be a hip abduction. And the hip abduction looks like this, where you're going to lay on your side and you're going to lift your top leg up into the air. You're going to do that 10 times each leg for 5 sets. Now, how are we going to prevent this from happening? Or if people are tuned in right now that don't think they have lower cross syndrome, or people are tuned in that are wanting to prevent this from happening, ways we're going to do that is going to be avoid seated positions for a long period of time. We're going to use preventative stretching or strengthening of the muscles involved. So once you get to a point where these symptoms aren't occurring anymore in your life, you can continue to do this going forward. Make this part of your regular routine to prevent it from happening again or prevent it from coming back. And if this isn't something that you've experienced yet, you can add these stretches and strengthening exercises into your daily routine to prevent it from happening in the future. Another thing you can do is warm up and cool down for heavy workloads. Or if you know you have a big job coming, you want to warm up those muscles and get them ready to go, and then stretch them out afterwards. And that's going to help keep you from injuring yourself and keep those muscles from getting super, super tight because you're warming them up and getting them ready to work. And also, again, touching on this, regular chiropractic care. I can't stress that enough. Keeping your spine in place so that your body, your nervous system can communicate and your body can heal like it's supposed to. The function, the healing is as good as it possibly can be. That's gonna go a long way in preventing this lower cross syndrome. So, thanks for tuning in. Again, I'm Dr. Nico Rocco. Let me know if you have any questions. You can comment on this video below. You can email the office. You can call the office. You can message me on Facebook. Any or all of those work. If you have any questions, comments, concerns, if you have someone that you think chiropractic care would benefit them, or if these symptoms or this condition sounds like someone you know, maybe pass this along to them so they can utilize chiropractic care and get some benefit out of it and make their body and their life and their function a lot better. All right? Have a great night. Thanks for tuning in.